Merhaba. Öncelikle
Hello, first of all, thank you very much for coming to listen to my presentation. Up until now, I'll try to summarize the things that have been spoken so far, and I will be speaking about the scales for psychodermatology. I categorize those scales: the life scales, psychometric tests, life quality questionnaire, and the dermatological disorder scales are categorized by me. Why we use those scales? First of all, psychological scales are enabling us to prove what we have hypothesized. The usage area of those tools are to enabling us to do a clinical study and to satisfy the needs of the patients and evaluate the efficiency of the treatment. The clinical evaluation studies are important. One of the questionnaires that we can use can be seen in my slide. All of those scales might be implemented for any kind of disorders. Whenever we think about a comorbidity, you can use those scales, but in psychodermatology, you can see which scales might be used. Of course, these scales have been used in different patient population. There is a scale which is called patient efficiency scale. It is in Turkish. Their effects on the quality of life is used. Psoriasis, atopic dermatitis, and in acne we use them. Short form 36 is in Turkish. We use it quite commonly. And it is about the experience of the patients in the clinic and what they are going through. The effects of the disease and the loss that disease is bringing to those patients are understood through this scale. It might be used in psoriasis and eczema. General health questionnaire, you can reach to its Turkish form. It is about diagnosed psychiatric disorders. It is used for malformations. Nottingham Health Profile is used for the medical intervention on the effect of life. Atopic dermatitis, in Behçet's disease, we are using them. The indexes of the patients are different from the indexes that I have mentioned to you. The most troublesome aspects are listed in this scale, and this scale is a patient-centered scale. In psychodermatology, there are many psychometric tests. SCL-90R is used quite commonly, and it has Turkish version. I believe it is a 90 question of scale. Somatization, the compression, and the distrust in social interaction, paranoid, anxiety, psychosis, and depression might be tested through this scale. And in a psychodermatology patient, you can see which patterns are much more common through this scale. If we have a large sample, we might also understand which personality pattern is more present in which patient group. This is quite commonly used, and we have the Turkish version. The other scale is Beck Depression Inventory. The Turkish version is present. It is used for 30 years in order to understand the severity of the depression. It is used commonly. It is comprised of 21 items. The pointing is between 0 to 63. General Depression Scale doesn't have a Turkish version. And you can evaluate the general depression levels. SCAPE coping questionnaire doesn't have a Turkish version, but it is quite important because we can test the coping mechanism under stress by positive and negative categories, so that in our clinical studies we might see whether our patients are using positive or negative coping strategies, and we can therapeutically inspect what we are doing. But it doesn't have a Turkish version. I can recommend an alternative. There is another scale, COP style scale. In 2013 it is validated for Turkish. It might be used as an alternative. If I'm going to speak about the psychometric tests, hospital anxiety and depression scale, it has Turkish version. It is used quite commonly in order to scale the depression. SCL90R might also calculate the same patterns, but in the medicine this scale is more commonly used for the calculation of anxiety. Cizan test, it was translated into Turkish as Ben form. The self-image of the patient is evaluated and the objective image of the person is compared so that you can test your therapeutic success, and this scale can enable you to do that. Fireberg personality inventory doesn't have a Turkish version, but it has the scale to evaluate the person from different perspectives. Aggression, intensity of the person might be evaluated through that inventory. All of the scales are self-declaration scale. Hamilton scale is done by a clinician and it is used in the clinical studies both in Turkey and also in the globe. Hamilton depression and anxiety scale is used by the clinician and it is trying to calculate the severity of the depression. And psoriasis might be also calculated through this scale. Rosenberg self-anxiety scale is comprised of 10 questions. This scale might be used for acne. It has been proven in clinical studies. Low self-esteem might be calculated through Rosenberg self-anxiety. Lubovitz social anxiety scale is our other scale. In different environment, the avoidance and the anxiety severeness is being evaluated. You might use it in different conditions. Psychodermatology, at least in Turkey, is a big field, so I'll try to give as many examples as possible about the usage of the scale so that we can have an open mind for new ideas. As Ali Jamal mentioned, cosmetic concerns are quite common in psychodermatological patients, but this is not enough to concrete our hypothesis. We are in need of scale, and social aspect scale might be used. This scale is showing us how the patient is adapting himself to the disease, and it might be used in all of the diseases. Alopecia areata especially, its field that is commonly used. Dermatology quality of life index is commonly used. It has a Turkish version. Symptoms and what the patient feels and the daily activity is used in order to evaluate the quality of life. It is used commonly, and you can see in which patient diseases it is used: acne, urticaria, atopic dermatitis, psoriasis, and etc. There is another scale through which we can understand the severity of the symptoms. Dermatologic specific quality of life is evaluating the emotionally the person. UK sickness impact profile has been developed in UK. In this scale there are 12 subcategories: hobbies and evaluating the free time are subtitles. Through that we can control the psychological change in the patient for long-term studies especially. This is another scale. It doesn't have a Turkish version. I believe it is important, that's why I added to my presentation. It is used in order to evaluate the problems because of the dermatological disease. Skindex is a common scale. It has Turkish version. It might be used for two purposes. These are the purposes. You can do the comparison between different dermatological problems, or you can calculate the psychiatric problems because of the dermatological problems. Lesion questionnaire. It doesn't have a Turkish version, but you can see how the patients are affected in the last 3 months. It was used for acne and atopic dermatitis. This scale doesn't have a Turkish version, but it is used for chronic dermatological disease. It is used for chronic dermatitis.
Örneklem çocuk olduğu zaman da
If you are working with the kids, there is two scales: children dermatology, life quality index for 4 to 16 years old kids. The children are answering the question themselves. If the child is below 4 age, then the parents will answer the questions. It is called Infant Dermatology Life Quality Index. Adjustment of chronic skin disorders scale doesn't have a Turkish version, and this one is about the psychological adaptation index. It is for the adaptation of the patient to the chronic dermatologic disease, and we are trying to understand the problems of the patients going through this process. Skin satisfaction questionnaire is trying to understand the stance of the person to dermatological problems.
Psychodermatolojide kullanılan yaşam ölçeklerinde diğer ikisi.
The other two, questionnaire on skin complexities. According to my idea, this scale is quite important for psoriasis patients. It is used for psoriasis and atopic dermatitis. It doesn't have a Turkish version, that's why it is not used in Turkey. It is enabling us to understand the stigmatization effect, and of course in psoriasis, patients have stigmatization effect. Fireberg life quality assessment is another scale. Through the treatment, the stress of the patient and the gratification of the patient is tried to be understood. It is used for psoriasis and atopic dermatitis. I just categorized different scales, and these are used for psoriasis and acne, alopecia. In psoriasis, loss of function index is present, and this index recently has been translated into Turkish. That's why it might be used in psoriasis patients. The other scales doesn't have the Turkish version, but I added them anyway. Impact of psoriasis questionnaire, psoriasis related stress scale, psoriasis family index. As you can understand from the names, it is calculating. Well, actually the name of the scales are standing for themselves. And through these scales we are also trying to understand the effects of the psoriasis on the family. For acne, there is acne inefficiency index. It is used for the inhibition of the functions. This has the Turkish version. Cardiac acne index is used in clinic because it's in Turkish and it has only 5 questions. It is much simpler for the patient, it is much shorter for the patient, it is, as a result, a matter of choice. Psychological and social effects of the acne is also evaluated. It is used for acne and it enables us to psychologically evaluate the disease. Acne specific quality of life has Turkish version. Cardiff doesn't have.
Yetersizlik indeksi, atopik dermatit yetersizlik indeksi, atopik
Eczema index, atopic dermatitis index, and dermatitis family questionnaire are the other scales. We are evaluating their impact on the quality of life. We are trying to understand the effect of the dermatitis on the family. Apart from that,
kronik ürtiker yaşam kalitesi anketi karşı
chronic urticaria quality of life index, pruritus is for the patients with itching problem. Itching quality of life, itching questionnaire are the scales. The first one has a Turkish version and the other one doesn't have. In the cases of itchings, we are using it. For alopecia, you see the scales on the presentation. They don't have Turkish version. For hair disease, you can see the scales from my presentation. Hairdex has Turkish version. And it might be used for the patients with the alopecia patients, with 100 alopecia patients. Scalp Dex is used for seborrheic dermatitis, allergic rhinitis, leg ulcer, and MM module are used. As you can understand from the name, the life quality might be understood, also in the leg ulcer. For melasma quality of life, its effects might be understood. Melanoma patients and their hardnesses might be understood, but we can also evaluate the post-chemo period. It is used in clinical practice. Thank you very much for listening.